Hi there, my name is Michaela Muse. I'm a PGY2 resident at Stillwater Medical Center, and along with Dr. Malayla and Dr. Anik, we started this QI project to increase hand hygiene in the inpatient setting. So, hand hygiene is one of the most effective interventions to prevent healthcare associated infections, but compliance remains inconsistent across healthcare systems. There's an update from the combined efforts of multiple societies implementing strategies to reduce the number of hospital-acquired infections and transmission of multi-drug resistant bacteria, and it helps in the transmission of emerging pathogens such as Candida auris. At our institution, like many others, our baseline compliance was approximately 30%, which you want to be around 60 to 70% to reduce the number of healthcare associated infections. Um, we saw there were huge variabilities and knowledge gaps, workflow inefficiencies, environmental constraints, etc. So our project was aimed at the improvement of hand hygiene compliance through a structured multiple disciplinary quality improvement approach. So we we implemented things such as multiple reminders, such as like posters in the hallways and in patient rooms to remind the staff to foam in, foam out. We also have a required health stream video to watch monthly to remind people how to go in and go out of patient rooms with proper hand hygiene. And with this, we saw a uh, huge change in the amount of hand washing. So the way we observed this was we had quote unquote secret shoppers. So we had our team of hand hygiene uh, QI project group that would go and watch people go in and out of rooms, and we had a standardized checklist for how we observed people go in our room. So did they foam in? Did they foam out? Did they wash their hands with soap and water if they were in contact? Things like that. And from our standpoint, baseline, we were at 30%, like we mentioned earlier. And after the implementation of our strategies, it went up to 75% just within 3 months, which is a huge increase and a 150% relative improvement. And it was statistically significant, of course. And that was just in a very short amount of time. We did it by unit as well. So this is the Women's Health Center. They were 92% compliant, the NICU, ICU, and like many hospital systems, the ED had the lowest compliance rate. Um, so we used um, many many systems and many ways we could improve hand hygiene in the hospital system. So here's kind of the overall time chart that we have. So baseline 30% dramatically increased the January, and it's been pretty consistent since then, which is really good because we want consistency as well. Um, so conclusion wise, we saw that our strategy was very effective in increasing the hand hygiene in our hospital. Um, it's very effective through a multimodal system-based approach, incorporating behavioral, environmental, and process interventions. There is still a huge variability across units, which we will address at the unit level um, later on. And we want to keep this going. It's not just like a one and done situation. This is a longevity project that will improve the healthcare, or sorry, the healthcare interventions of our patients and reduce hospital-acquired infections in our patient population. So, like I said, um, we will use the high-performing units as models for best practices. Um, Standardize real-time tracking, expand observation network to improve data reliability, and kind of go from there. So here's our project, and we are excited to meet with you at the symposium.